Welcome to This Week in Health IT News, where we take a look at the news which will impact health IT. This is another field report where we talk with leaders from health systems and organizations on the front lines. My name is Bill Russell, healthcare CIO coach and creator of This Week in Health IT, a set of podcasts, videos, and collaboration events dedicated to developing the next generation of health leaders. Are you ready for this? We're going to do something a little different for our Tuesday Newsday show next week. We're going to go live at noon Eastern, 9 a.m. Pacific. We will be live on our YouTube channel with myself, Drexta Ford, Sue Shade, and David Muntz with Starbridge Advisors to discuss the new normal for health IT. With you supplying the questions with live chat. Also, you can send in your questions ahead of time at hello@thisweekinhealthit.com. I'm so excited to do this, and I hope you will join us. Mark your calendar, noon Eastern, 9 a.m. Pacific on April 28th. If you want to send the questions, feel free to do that. And you can get to the show by going to thisweekhealth.com/live. This episode and every episode since we started the COVID-19 series has been sponsored by Sirius Healthcare. They reached out to me to see how we might partner during this time, and that is how we've been able to support producing daily shows. Special thanks to Sirius for supporting the show's efforts during the crisis. Now, on to today's show. Today's conversation is with Tiago Frigini, the telemedicine medical manager for America's Medical Service, and Varun Anand, healthcare entrepreneur and co-founder for MphRx, which is the company that has created this platform called Minerva. And I'm really excited to talk to you guys about this. But before we get going, good morning. Welcome to the show.
Good morning. Thanks, Varun. Thanks, Bill, for the invitation.
Yeah, I'm looking forward to it. So we're cross-continent here, so I'm looking forward to this. We're a big proponent of platforms on this show, so I'm really looking forward to discussing the use case around this and what you guys have been able to do. Before we do that, Tiago, Varun, if you guys could introduce yourself, give a little background for the audience, that would be great.
Okay, I'll start. So my name is Tiago. I'm a Brazilian doctor. I work with health IT for about 9 years now, and I work now as a telemedicine medical manager from Amil Medical Services, which is part of UHG Brazil. So it's a company that you might know as UnitedHealth Global. And then I started working with this health IT thing about 9 years ago, when I started to implement some decision support tools for the physicians embedded into the EMR. So the physicians they wanted to know the treatment and the diagnosis for the patients, and we had some algorithms to help them to do that.
Fantastic. Varun, you want to introduce yourself real quick?
Sure. Thanks, Tiago. Thanks, Bill. Varun Anand, one of the co-founders at MphRx. We've actually had a pretty interesting journey. We started back in 2010. Actually did a lot of work as a mobility platform in healthcare, and around 2016 ended up pivoting and building a new platform called Minerva. So at a high level, it's an open interoperability and digital transformation platform deployed in over 20 countries, serving over 300 million patient lives overall. And the way I kind of try to explain it is, we were kind of like a Lego box, or a collection of Lego blocks of tools that can be very quickly stitched together in a vendor-neutral manner to drive engaging digital transformation projects. And kind of what we're talking about here, and what we've done with UHG, with the COVID-19 crisis as well.
Yeah, so the reason I'm looking forward to talking about this, we talk about platforms a lot, and people are like, well, why do you push platforms so much? Well, it's really the speed and the agility that people can work with, because the security is already baked in, and it's, as you say, it's Lego blocks, right? So it all just sort of pieces together. And so when I came across this, I thought this would be a great conversation. So America's Medical Services, part of UHG Brazil, deployed the COVID-19 triaging, monitoring, and teleconsultation workflow on the Minerva platform in a vendor-neutral format across multiple EHRs. So there's a lot in that statement. So let's just start with Tiago. If you could talk a little bit about the problem you were trying to solve as you were approaching this.
Sure. So as you can see from my background here, we are sheltered, working from home, and then we have, as UHG Brazil here, we have 35 hospitals and a lot of urgent clinics, and as you can tell, COVID-19 is becoming a big issue here in Brazil as well. And we needed to talk to our patients and to get them safely discharged from the hospital so they can go home and does not stay into the hospital and get more infection and more other diseases. So we have both workflows that's implemented. So before the patient come to the ER, we have this triage system so the patient is not unnecessarily going to the ER, and the post-discharge flow that when the patient is discharged from the admittance from the hospital or the ER, we start to monitor these patients for 14 days so they can access this online questionnaires for their symptoms. And then tests are automatically created to the physicians, so we can track these patients. But my bigger problem was actually that I do not have much physicians or nurses available for this, since they are on the front of the battles with the COVID-19. So. I was looking for a platform that could scale up the physician I have and could automatically triage this patient, so I don't lose any time looking for the patients that are perfectly fine.
Yeah, no, that's fantastic. And we've seen the telehealth, the triaging, the monitoring, anything where we can really reduce the number of touch points and exposure to potential COVID-19 is in protecting the clinicians has been just a phenomenal solution at this point. But why a vendor neutral solution? Why is a vendor neutral solution important?
Because actually we as a hospital group, as America's Medical Service, we wanted to provide the service for our patients so they can understand that this was a system that was provided by us, and again we are not charging the patients from that. So the patients had already gone to one of our hospitals, and we are giving this platform, this access for them for free, so we can improve their health. And that's why we looked for a vendor neutral solution.
Fantastic. So Varun, give us some idea of what are some of the benefits of working with a platform in this scenario. Walk us through the engagement and what you've been able to do.
Sure. So just to kind of walk you through the story, right? So as we guys started talking to Tiago and actually a few other customers, we started really learning about what the ground realities were around COVID-19, specifically in Europe and what we were seeing in Brazil, in Asia, and the US. And what we actually figured out was one of the biggest challenges right now with this virus was that was the overall healthcare delivery capacity, right? Anyone that came in with any kind of cold, common flu symptoms, they thought that they had COVID-19. Even patients that had mild symptoms, at the end of the day, the way they were taken care of was by asking them to go back home, be in self-isolation. And where we were seeing health systems get overwhelmed was when everyone would actually end up coming to the ER. Everyone would end up, having to come to see their doctors to get diagnosed, only to be actually told to go back and be in quarantine. As we noticed this, we actually realized that there were a lot of building blocks that we already had in the platform, right? The ability to create a public link which patients could quickly open up, put in their information, put in their symptoms, automatically register onto a patient app, the ability to create a quarantine care plan, which essentially meant that Tiago and his and our customers were able to define and say, when a patient is in self quarantine, every day I want to send them a check-in questionnaire, right, asking them if their symptoms have changed. Every day I wanted to send them some educational material. So these capabilities were all really configurable through a user interface. Where, in fact, what's really been interesting is our customers are actually defining a lot of those workflows on our own. The teleconsultation piece, the ability for patients that are identified as high risk or medium risk, for them to be automatically triaged through a logic, put into a work list where the clinical teams could essentially start focusing on patients that had high risk or medium risk symptoms, set up teleconsultations around that, and keep them basically engaged remotely. The overall objective here was to basically have our clinical resources focus on patients and on essentially part of the public that really needed to be seen in an emergency room or needed to be seen in the hospitals, rather than having to monitor a much larger. So it's really a scale problem, right? That's basically what the pandemic really showed. Now, just to give you some numbers, I mean, we deployed this particular use case within 72 hours, right? So we actually set up a new platform, a new instance for UHG, branded it, actually translated it into Portuguese, which was quite a fun exercise. Translated it into Portuguese, put it out there, and they started using it on the fourth day. In terms of and what we also realized was that because we're actually deploying something and we're also learning from these patient experiences and what's really happening on the ground, it's also important to be agile in terms of making modifications, making changes, adapting to new workflows on the fly. Now, if it wasn't a platform, if it was something which was hard-coded or kind of custom tailored to building this, every time you had to make any of those modifications would have been a development cycle, and I don't think that could have been up and running in 72 hours. So that's really the power of how having these platforms in place can really help deploy, go to market with these kinds of solutions really, really quickly.
Yeah. So so that is the benefit. It's configurable versus programmable, right? So you're essentially just going into an interface, configuring some things. Those components are already built for deployment within the communities that UHG serves down there.
That's correct. And if you really think about it, doing this in 72 hours. And the other piece also which we're seeing is, as the virus and as the pandemic is progressing, the actual needs are also changing on the ground, right? So the same triaging logic, which was earlier being used by, for patients, outside the hospital or patients coming into the emergency room. Now the bigger concern is the health workers, right? The doctors and the nurses. They're actually contracting COVID-19 as well. So the same workflow with a little modification needs to start working for tracking, health workers on the other end, right? So this agile approach of being able to really respond to these situations that really comes in handy, especially when we're dealing with something like this.
So, Tiago, did you have to feed the information back into other systems once it goes through this workflow?
Yes, we actually are working on one integration that will record this information that we input, register into Minerva system, and it goes back to the hospital EMRs. So to the patient EMR where the patient has gone in the past.
Yeah, so Varun, that's always one of the questions. It's like, okay, vendor neutral, we're going to pop this thing in, and then people sort of get stuck. They go, but how are we going to get this information moving around? But your platform actually is pretty elegant in terms of how it stores and moves that data around. Can you talk a little bit about that?
Sure. So one of the things that we guys did when we built the platform back in 2016, we were lucky that there was a new healthcare standard coming about, right, which was FHIR. And when we looked at FHIR, one of the first realizations was, hey, if you're building a platform that's pulling in data together from these different systems, it doesn't make sense for us to create another proprietary data model. So we latched onto FHIR. In fact, our data model is completely based on FHIR, which means, as even these workflows that we've deployed, the data that's actually been captured is being captured in an open standard. And as integrations basically open up with the EMRs, with the different source systems, there's not a lot of translation work, or it's not in a proprietary format that it's very difficult to get integrated with. Plus, interoperability was essentially our mainstay, right? We did so many healthcare data integrations across the course of the company in different healthcare environments. We kind of realized the reality of healthcare data, which is, I like to say this, that healthcare standard sometimes is like an oxymoron, right? I mean, everyone ends up having their own version of it. And so we built an ability within the platform to quickly integrate, whether it's with healthcare standards like HL7, XDS, CDA, FHIR, or as you see with a lot of implementations across the world, a lot of IT systems don't speak these standards. So you're still down to doing CSV integrations, you're down to doing web services and APIs, and the key to digital transformation is the cost of doing those integrations, right? How quickly and how cost effectively you can integrate it with your core systems really makes a big difference on how effective a solution or an engagement would be.
Yeah, Varun, I'm going to come back to you because I want to talk to you. I want you to talk some of those building blocks, the chatbot, payment gateway, and those kind of things. But before we get there, Tiago, I'd love to hear how the consumers or the patients are responding to the solutions that you put out there at this point.
So we just achieved the 2-week implementation. Just yesterday. So we are getting some spontaneous feedback from the patients during the teleconsultations, and they are phenomenal. The patients are really excited. The patients are glad that we are taking care of them. But we do not have a measured system like a NPS or something that we are starting to send these questionnaires for the patients like today, because we didn't want to bother the patients so they can answer this NPS on every single teleconsultation. And we just assumed that it would be better for us to have a whole program NPS at the end of the care plan. So that's why I don't have this at now. But the patients are spontaneously giving this feedback for the doctors from the platform and the care that we are providing to them.
Yeah, no, that's great. Varun, give us a couple of the building blocks, and then we'll close out by talking about where this could go. Well, once this is in place, I know it's 2 weeks into it, but one of the magic things about a platform is it's only limited by your imagination. But with that being said, what are some of the building blocks that UHG took advantage of, or just some of the other building blocks that are in this platform?
Sure. So some of the building blocks that really come in place is, number one, the ability to really quickly deploy white labeled web and mobile, apps for patients and clinicians, right? So what we're deploying here is not something which is MphRx branded. It looks like an Americos app. They're actually, we're releasing an iOS and an Android app, to these patients as well. So there is that front end layer which is flexible, and you can configure that. And then the other piece is that the building blocks that really come in is around, the patient identity, the consent management, how you can sign them up through email or phone number, and that's always a complex thing to do, right? When you're going out and you're engaging with patients that are not already part of your ecosystem. We already had, a workflow engine where through a UI you could very quickly set up care pathways where you could say that, hey, if somebody's put on a self-quarantine plan, this is what needs to happen daily. I want them to record their temperature. I want to record their SpO2. So all of those things that was a framework already built in. Similarly, the ability to do alerts and notifications, which we're doing right now. So you're actually sending out alerts and notifications to patients as well as to the providers saying that, okay, these are 4 things you need to do today, or follow-ups around that, and so on and so forth. The teleconsultation piece is interesting. So we actually, within the platform, had integrated a framework which was based on WebRTC. This is a very interesting standard where you essentially don't need to install anything on web and mobile devices. And if you think about it from we guys all get on conference calls, and it's always every conference call is interesting because somebody's downloading an app or somebody's downloading a plugin, right? And the moment you start, opening that up to sick patients, that becomes a bigger challenge. So, the teleconsultation workflow is zero install, whether it's on the iPhone, Android, or on a tablet or a computer. That really reduces the friction for patients and providers to really use it. And then, more importantly, I think underneath the ability to store all of this information in an open standard, making it, something that can be cross-leveraged in the future as well. Also, because we've been doing a lot of our projects have been patient-facing, we also start looking at, the overall engagement metrics, right? Which I think every time you're doing some, any kind of remote monitoring, digital transformation piece, that becomes important. So just as an example, in the last 10 days or so, I think I think we're roughly tracking about 1,500 patients. I think Tiago and I were talking about this, where of those 1,500 patients that are being tracked daily, they've done 400 teleconsultations, right? Of those 400 teleconsultations with those patients, only 10 have actually been asked to come back to the emergency room. And of those people that have been asked to come back to the emergency room, 0 have been hospitalized. So those are the kinds of metrics you really need to track to drive, you really understand what ROI or what impact you're really making in this situation.
Absolutely. So where are you? And plus you have, you guys have a ton of stuff in here, like online payment gateway, fraud prevention. Just chatbot capabilities, eligibility checking. I was looking at the list of this stuff, and I'm sitting there going, yeah, that's the building blocks, right? I just sit back and I don't have to build that. I just go, yeah, I need a payment gateway. Yes, I need this. Yes, I need this. And that's the beauty of a platform. It's configurable as opposed to building it out. And having been a CIO who built all that stuff out, I'm glad there's now platforms that you can just configure them, because it represents a lot of work. So where do you go from here? This is the last question. So where do you go from here? Where can you go from here?
Actually, I think I can start with that. As you were telling, we are implementing some other blocks that we need here. So one of them, it's including, I don't know if you have this demand in US, but here we have a virtual urgent care queue line here as a demand. So the patient wants to see a doctor right now, so they can click on the button and stay online in a virtual queue. So the doctor will pick this patient up and talk to the patient without having to schedule the appointment. And this is one of the things we are implementing by the next week. And one of the things I asked Varun to develop. But for us to have this, we needed to get the online payment and the eligibility too, so the insurance can pay us for this visits, because the patient won't have passed through one of my hospitals. And then one of the things we are trying to prevent here is the fraud. Because the payers will ask us to do that. So we are implementing the facial recognition in the moment before the teleconsultation as well. Another thing is this chatbot to ease the interaction from the patient through the platform instead of the questionnaire. So it's more natural for them to answer the bot than to just answer the questionnaire. And another thing that I need the Minerva platform will solve is the doctor-to-doctor discussions. We already have this running right now, it's this project goes back to 2011. We have discussed more than 60,000 patients within this 9 years. And as we are a group of hospitals, we have some centers, then systems of excellence that are dedicated to a specialty or some cardiology cases or neurology, and we transfer patients between our hospitals. And this is one of the bigger problems I have right now, because I have different hospitals with different EMR bases, and the patient's EMR is not accessible from one hospital to the other. So we have a lot of paper being translated with the patient, and a lot of time that the physician wastes getting the information from the other hospital, and this can be automated by interoperability tool. That's our last goal.
That's fantastic. Gentlemen, thanks for your time. Varun, if people wanted more information on this, where could they go to get some more information?
So they can go to our website, MphRx.com, and we'll actually pass you a link that you can make part of the podcast as well. So we've actually been talking a lot about this particular workflow, as well as how health systems can use this going forward as well. Because I think one of the things that I guess is the way I look at it is that COVID-19 is becoming definitely a catalyst for a lot of these kind of tools to be deployed and very quickly used. But once in the next few months, as the crisis unravels itself, the general behavior will also change, right? So the capabilities that we've used to take care of COVID-19 patients remotely can also be transferred to oncology, cardiovascular, renal diseases, and so on and so forth. So other specialties as well. So we've got some content on our website about that, and happy to share the link about it as well.
MphRx.com?
Yes.
Great. I'm going to put you on the spot one last time, which is, how does an entrepreneur come up with a name? And how did you come up with that name?
It actually goes back, about 10 years. Mahesh was our CEO. The early idea behind, the company, we were three tech guys who got into healthcare, right? And our biggest question was, why is it so difficult to get patient records from point A to point B? And why don't patients have access to their own records? We jumped into the industry thinking that's a problem that needs to be solved. And initially we thought we'd be a PHR, the patient health record system. And we thank our stars that we didn't do that back in 2010, and we didn't go down that path. But the name of the company came from that. It was My Personal Health Record Express. After you have a few customers and you start basically going out in the market, we I think grew attached to the name and the history behind it.
Yeah, I'm kind of making fun of you, but it is a pretty easy to remember name, MphRx. So, and gentlemen, again, thank you for your time. I really appreciate it.
Thanks, Bill. Thank you, Tiago.
That's all for this show. Special thanks to our channel sponsors, VMware, Starbridge Advisors, Galen Healthcare, Health Lyrics, and Pro Talent Advisors for choosing to invest in developing the next generation of health leaders. If you want to support the fastest growing podcast in the health IT space, the best way to do that is to share it with a peer. Send an email, DM, whatever you do. You can also follow us on social media, subscribe to our YouTube channel. There's a lot of different ways you can support us, but sharing it with a peer is the best. Please check back often, as we will be dropping many more shows until we flatten the curve across the country. Thanks for listening. That's all for now.